You're watching Cetome TV. Knowledge is power.
Okay, Carol is asking, are there special herbs and supplements that could be helpful in preventing cancer?
Yeah, it's interesting. There's lots of plant phytochemicals that can have a specific role in reducing certain cancer-causing pathways. Now, it's very uncommon that you're going to find a magic herb or um, supplement that is going to stop a cancer, because cancers have many functionally redundant signaling pathways. What you can do is you can have impact on reducing the growth of that cancer and reducing its ability to metastasize by plant phytochemicals. Certain ones like curcumin, from turmeric, quercetin. What else?
Resveratrol.
Resveratrol is another one. ECGC from green tea. We had one interesting case where, a few years ago, a person had prostate cancer, and it was against their religion to have their prostate removed. And so they wanted to treat it with just herbs and supplements. So I suggested a type of green tea called Sencha Uchiyama. That has a high ECGC. And so this person would drink gallons of the stuff every day. They would literally make this tea and just drink it all day long. And, I was constantly, they weren't a patient of ours, but, they would call every now and then and ask for advice. And I remember saying, you've got to get this treated, you've got to get this taken out. This is going to be a serious problem. You've got to get those tumors removed. The person had like 6 or 7 different tumors in their prostate. And then I get this call from the individual's wife, and she said, it's been 2 years now, and we just had our latest MRI, and all of the tumors are gone except for one. And the last one that's there is getting cut out today, just the tumor, which was allowed by this individual's specific religion. And I said, I don't believe you. So she sent me the medical records. And sure enough, spontaneous remission maybe. But
that's 2 years of massive green tea
massive
intake.
amounts of ECGC.
Yeah, who knows what else they did.
There's some healthy diets. The person exercised a lot too. So,
Point is
you can't
lifestyle.
underestimate lifestyle benefits. We've seen patients go from poor diet. They'd call us. We'd look at their blood profile. We'd get them on a healthy diet. We'd get them on some supplements, or just, eating herbs and parsley and rosemary and things that are beneficial for you overall. And weeks later, they would get their blood back, and it would just be completely cleaned, and the numbers would be down to normal. So don't ever underestimate the benefits of healthy lifestyle, but it's not a treatment.
And what I do understand, Alex is not saying take any supplement.
No.
Try anything. There are some that have peer-reviewed medical science that show benefit.
It's about 4 or 5.
Yeah,
right
that's the thing. So, don't go for the dandelion root and the various other things that you might read about or the other folks might talk about. It's fine if you're looking like online, you're doing some reviews to find out what other people have used or benefits they've had, but you've got to then go from whatever site you're looking on right there, and you've got to head over to a site like PubMed, where they actually have the proven scientific information, and make sure that those claims are substantiated there. Otherwise, you could be actually undermining your health, because some of these supplements can work against the treatments that you're on.
Yeah, and I think that's an excellent point that you brought up. There's a lot of studies for a lot of strange different plant phytochemicals and alkaloids and so on that do really well in a petri dish and kill cancer cells in a petri dish, but basically do nothing in the human body. There's about 4 or 5 supplements that have actually gone to human trials and had some benefits. Now, of course, not all the trials showed benefits. There was a lot of variation in how those trials were done. But I think consistently there's about 4 or 5 of these supplements that we mentioned earlier that have had some benefits in human trials. Whether they've been used. They're not cures by any means, but they definitely can have a synergistic effect in slowing things down. A good one that springs to mind is a recent study with the 9-bean combination in colon cancers. Almost doubling survival of patients with late-stage colon cancer. And that was a interventional study done, I believe, at the Mayo Clinic, I think. And then there's a recent study of fiber and I believe it was yogurt, probiotic from yogurt, reducing breast cancer, lung cancer metastasis by 30%. So definitely there is a lot of value in it, but make sure you look at the human trials and make sure you look at PubMed. Don't just go for something because it's benefits in a petri dish.
I mean, you offer a consultation with a special diet and looking at what is known.
Those are human interventional studies and observational studies where people described what they had. So yeah, definitely everything we suggest has a basis in humans.
And that's what you should expect of anybody who's recommending any supplements or alternative therapies, is that they can show you on a site like PubMed, peer-reviewed medical science only, that what they're suggesting actually has been tested and shown to benefit humans, not mice, not petri dishes.
Thank you for watching Ketome TV. Subscribe below and stay informed.